Welcome to another episode of Med Madness. In today's podcast, we're diving into the fascinating world of ovarian tumours, specifically focusing on one of the most common benign ovarian masses in premenopausal women, the mature cystic teratoma, also known as a dermoid cyst. These unique tumours are made up of tissues from all three germ layers, endoderm, mesoderm, and ectoderm, giving them a distinctive composition that often includes hair, teeth, and even sebaceous material. While typically asymptomatic, these cysts can present with significant complications, most notably ovarian torsion, which we'll explore in detail today. Next, let's discuss the pathology of mature cystic teratomas. These are benign germ cell tumours that arise from totipotent cells capable of differentiating into various tissue types. These tumours are composed of elements from the endoderm, mesoderm, and ectoderm, which explains the presence of diverse tissues such as hair, teeth, and sebaceous glands within the cyst. Moving on to the clinical features, most mature cystic teratomas are asymptomatic and are often discovered incidentally during routine pelvic exams or imaging studies. However, they can grow large and cause symptoms related to mass effect or complications like ovarian torsion. Ovarian torsion is a particularly serious condition where the ovary twists around its supporting ligaments, leading to compromised blood flow. This can result in severe pelvic pain, nausea, vomiting, and potentially peritonitis if left untreated. Now, let's talk about imaging and diagnosis. On ultrasound, mature cystic teratomas appear as complex cystic masses with characteristic features such as calcifications, often representing teeth, and echogenic bands representing hair. These findings are key in differentiating teratomas from other types of ovarian masses, such as endometriomas or serous cystadenocarcinomas, which have different ultrasound characteristics. When a mature cystic teratoma is diagnosed, management typically involves surgical removal. This can be done through ovarian cystectomy, which preserves the ovary, or oophorectomy if the ovary is severely damaged or if there are concerns about malignancy. In cases of ovarian torsion, prompt surgical detorsion is critical to restore blood flow and prevent ovarian necrosis, which could impact fertility. Now consider a real-life case study. A 28-year-old woman presented to the emergency department with sudden onset severe lower abdominal pain. She reported feeling perfectly fine earlier in the day, but the pain became excruciating and was accompanied by nausea and vomiting. An ultrasound revealed a large, partially calcified cystic mass in her right ovary, with decreased Doppler flow suggesting compromised blood supply. Given the clinical and imaging findings, a diagnosis of ovarian torsion due to a mature cystic teratoma was made. The patient was taken to the operating room for emergency surgery, where the ovary was successfully detorsed and the teratoma was removed. She recovered well and was able to retain her ovarian function. In summary, mature cystic teratomas are common benign ovarian tumours that, while usually asymptomatic, can lead to serious complications like ovarian torsion. Recognizing the clinical and imaging features of these tumours is crucial for timely diagnosis and management. To reinforce your understanding of this topic, don't forget to engage with our pre- and post-podcast quizzes and explore the Anki flashcards we've prepared for you. These tools are designed to help you solidify your knowledge and prepare you for your exams. Thank you for tuning in to Med Madness. Stay curious and keep learning.